Hello, everyone. I'm Michelle Berry, Director of the Center for Innovation in Global Health here at Stanford. Thank you for joining us today for another wonderful, hopefully, and I'm sure, global health conversation. It's my great pleasure to be introducing Dr. Patty Garcia. Dr. Garcia is an internationally recognized and acclaimed global health leader and former Minister of Health of Peru. She has fought for health equity in this country for many years, including through this pandemic. Dr. Garcia graduated from medical school at Cayetano Heredia University in 1988, becoming the first in her family to obtain a university degree. After doing her residency in the US in Miami, she completed an MPH at the University of Washington and also completed her PhD at Cayetano. Currently, Dr. Garcia is a professor at the School of Public Health at Cayetano Heredia University in Lima, where she has also served as the dean there. Dr. Garcia has the distinction of being a current elected member of the US National Academy of Medicine, the first Peruvian to receive this distinction. She has many firsts we can talk about. While serving as Minister of Health of Peru from 2016 to 2017, she fought corruption and introduced new policies in sexual and reproductive health, HPV vaccination, cervical cancer, and more. And during the pandemic, she led clinical trials in Peru, chairing the governmental committee on innovations to fight the pandemic. In addition to all of these accomplishments, Dr. Garcia has distinguished herself as a fearless advocate for health equity and has spent much of her career forging a path for female leadership in Latin America. Thank you for joining us, Dr. Garcia. It's a pleasure to host you. Today, we're also joined by Paul Costello, who will be leading our conversation and also the Q&A. And while we're talking about that, please put your Q&A questions in Q&A, because we will leave 15 minutes for an interactive conversation with Dr. Garcia. For 16 years, Paul served as Chief Communications Officer at the Stanford School of Medicine. He's now adjunct faculty in the Department of Medicine and a Global Health Faculty Fellow at our center. And lastly, I want to remind people we'll be holding our annual research convening this coming Monday at Arriaga Center. Paul, I will turn it over to you.
Thank you, Dr. Berry, and thank you, Dr. Garcia, for joining me today. And from here, moving forward, we agreed I could call you Pat. Is that fine?
Absolutely. I was surprised that Michelle was calling me Dr. Garcia. I'd rather be called Patty.
Okay. You know, I wanted to begin, just a moment ago, we were talking before we went live, we were talking about the pandemic and isolation. And I wanted to hear from you about your own personal confrontation, I guess I'd say, with isolation and with, you know, not being able to travel, et cetera. What has the pandemic been like for you personally?
Well, I guess I cannot complain that I have a great family. And actually in my house, it has been my husband, my two kids that are now physicians, so they have been also busy, my mother-in-law who is 92 years old, and my two dogs. So I have a family with me. But it has been hard, as probably has been with the rest of the people in the world, not to have that human connection that we used to have in different settings, not only traveling, but within my own country. I mean, like going to the university, interacting with the students, interacting with the team with whom we were doing research. I mean, as you have heard, I even during the pandemic, because of that frustration, we kept trying to help and doing clinical trials. And believe me, it has been so complicated because it was like doing research in the middle of a war, because it has been really a war. So being isolated, although with the family, not having the contacts, I think at some point, all of us had been suffering also from Zoom mighties. So too much Zoom and not touching the people, and being a lot in person, it has been even worse. So I still dream. It's true that it sounds like it is more efficient because I don't need to take a lot of time commuting from one place or the other or traveling, and maybe it's good for the environment. But I think it's also good to have human interaction. So I'm still missing that. And in order to avoid problems, I have been exercising and doing some gardening, as you can see there, with a little tree that I have in my back.
What is the state of the pandemic in Peru right now? And is the subvariant, which is now globally dominant, is that taking hold in Peru?
Well, first of all, I have to tell you that Peru was one of the countries that had been hit more or hardly, has been hit very hard by the pandemic. Okay, and we are the champions, unfortunately, of deaths per million in the world. However, since probably 4 months or 5 months ago, the number of cases and the number of deaths have been going steadily down. And right now, we have a number that we never had, even from the beginning of the pandemic. So we do have the new variant, but somehow is not affecting us. People still use face masks. So we use face masks in indoors and in outdoors, and everybody is required to show their vaccination card with 3 doses. And actually, maybe the reason why we're doing much better right now is because the level of vaccination in the country is relatively high. So we have about 80% of the people with 2 doses and close to 60% with 3 doses in a country that has all kind of challenges because of geography. Still, there are some pockets with a little lower vaccination, but no region is lower than 60%. So maybe that's why right now things are calming down, but still universities are not open, for example, and we still have some restrictions.
Has there been effective political leadership on this issue in Peru?
Well, unfortunately, and that is part of the contextual issues that definitely affect health, and sometimes we ignore. The political context in Peru has been very, very unstable. And it has been unstable for the past 5 years, but during the pandemic, they had been even worse. So we have had close to 11 or 12 ministers of health total within this period. During the pandemic, several changes of ministers of health. We have changed 3, I'm losing the count. I don't know if it is 3 or 4 presidents, okay, between presidents and vice presidents. So you can imagine that the contextual, the context has affected definitely the way the country could respond to the pandemic, and the trust of the people to follow rules, and the availability of basic supplies. So it has been hard. So I think maybe because of all that instability, plus a very fragmented health system and other things that we have that are had made us more, it had made more difficult for us to really confront the pandemic. And the results are the numbers that are showing that we had too many. I mean, one is it's too many deaths, right? But we have had too many compared with the rest of the world, really.
What's been the impact of fake treatments like ivermectin? I know that in South America, you know, there was recently a clinical trial, large clinical trial, 1,300 people infected with the virus in Brazil. Some received, you know, ivermectin, others received a placebo, and it concluded that there was no benefit. What has been the impact of these fake false treatments in Peru?
Well, yeah, it has been devastated, I think. And the reason is that at some point, the use of ivermectin, hydroxychloroquine, okay, make people, regular citizens and providers that were not, that were following whatever was around there, make them feel more comfortable and with this false sense of security that there was something that could be given to treat if somebody get infected. That's one. The second thing is that in the case of ivermectin, this is very particular, okay? Ivermectin is a drug that in Peru, and in the rest of Latin America, is very common, very popular. You can buy it openly in the pharmacies because it's an antiparasitic, and we have lots of parasites. So as soon there was, and this is also the role of social media, as soon a couple of articles came and were open, and people started sharing these articles in the social media. One from the US that was saying like that the FDA approved drug ivermectin has effect over SARS, and it was an in vitro study. So that was one article. And then another article that from a Dr. Patel and Dr. Mehra, who was referring to a database that they analyzed of cases around the world using ivermectin, and that it was incredible, that later on showed to be false. Those two articles that were just released to the regular citizen that is not used to read or to understand what is fake or not, or what is real, caused a boom here in Peru. And that there was also a division between the professionals. Some of us that were saying like, this is, I mean, there is a need to have clinical trials, and others that said like, we have to do something. And then the citizens that could get the medication freely. So at some point, we didn't have any more ivermectin in the pharmacies because everybody was buying it. And then people started using ivermectin in different ways, not only to treat, they were using it once a day, once a week, every time they were feeling sick, as prevention. So, and that caused this false sense of security. People were coming to the hospitals late when they were very sick. They were not using protection. So I think it was really devastating in my country, but also in other Latin American countries like Bolivia, Paraguay, and Brazil. At some point, the government, okay, decided to put these two drugs, hydroxychloroquine and ivermectin, as part of national guidelines. And even in Brazil and then in Peru, packets of treatment were distributed home by home with ivermectin. That was really crazy. And I think that has really caused a lot of the damage that we are seeing now. Unfortunately, that happened in the first wave of the pandemic. At some point, we stopped using it, but then countries like the United States and Europe never wanted to hear what we were saying, because we were saying there is a need of doing a clinical trial. We need resources. We have to do something. And then in these countries, you started using these drugs, and finally, somebody decided to fund the clinical trials. I mean, we tried to do a clinical trial here in Peru, but it was so difficult because everybody, at some point there was a survey that showed that between 70 to 80% of Peruvians have taken ivermectin at some point during the pandemic. So it has been the use of fake medications, the lack of good knowledge or basis of what evidence-based medicine is from the providers, I think have been critical for us. Ivermectin is the best example, or the worst.
Let me go back and do some biography with you. As Michelle mentioned, you graduated. You were the first member of your family to graduate, to receive a university degree. Your father, you were born in Lima. Your father was a journalist. Your mother was a housewife. You know, it's interesting. You opened by saying, when we talked about COVID, that two of your children are physicians. And the jump is always amazing to me, how your family just jumped. You know, two children. You were the first to graduate from a university, and now you have two children who are doctors. The ability of generations to jump globally is pretty impactful. Who were the major influences in your young life, and how did medicine and public health begin to take shape?
Yeah, well, you know, um, I think I remember, I think the first thing that I could remember is when I was 5 or 6 years old. I got very, very sick. Okay. So sick that I was hospitalized in the big children's hospital here in Peru. Um, and I think that moment, because there are moments in your life that really are decisive for what you are going to do or what you're going to be. That was a decisive moment. I remember I was feeling so sick and I was so afraid of what was going to happen. But there were young doctors around me and they explained me, they were taking care of me. They explained me what was going on. They told me not to fear. And when I started getting better, I decided that I wanted to be like them. Okay. It ended up that I was having an infectious disease, which is called brucellosis, which you get it from contaminated cheese, goat cheese usually. And at that point, when I was little, that was a very, I would say, endemic and epidemic in several parts of the country. Okay. So at that point, I decided that I want to be a doctor. But the other thing that was quite important in my life, I think, was the influence that my grandmother had on me. My grandmother was Andean, was from the Andean region, but she was also shamana. So she came from the Andes to stay with us in our house because I was still, I mean, I stayed in the hospital like for 6 months. Initially, they thought I was having a leukemia, and it ended up being a very, very special presentation of this brucella with damage of the lymph nodes and certain organs, right? So my mother-in-law, my grandmother came to help my mom with me also. And she started to tell me about diseases, and I started to help her because she was still in the yard, in the backyard of my house. She was seeing patients and she was passing a little animal that we call cuy, okay, that for you is the guinea pig. Okay, so because it's supposed to have magnetism and cure diseases, and you can make diagnosis or pass the egg, etc. But one of the most important things that I learned from her was how important is to establish a relationship, a personal relationship between the person who is trying to take care of the disease and the patient. So my experience with these doctors when I was very young, and I felt really, I trust them and I felt that they were going to help me, and they helped me. My grandmother giving me this other view. And then, I mean, I was convinced that I wanted to be a doctor. So I decided and I studied for that. I entered to the university very young, about 15 years old. But I always thought that I wanted to be a doctor just a clinical doctor. I think I'm a very good clinician, okay? And I love to interact with patients. But it was until I was in the US and I started doing my residency in infectious diseases that I met Dr. King Holmes from the University of Washington. And I remember that talking with him, he was trying to push me into research and work in public health. And I said, like, at the university, several times, people that were working in public health were seen as second, like not the very brilliant or the very intelligent were going to do public health. The intelligent ones will go into do clinical work, right? So, but he was saying like, no, that public health is so important because one thing that you can do right can benefit hundreds of thousands of people. And actually, he challenged me. And because of that challenge, I started doing my MPH and I loved it. And so I do very little clinical work now. And what I do is I work in public health and now in global health, because what we have learned, and I think the pandemic has shown us that too, is that there are no boundaries really. And global health is like the public health of the world. There are no boundaries between countries, and we have to work together if we really want to do something different. We all share vulnerabilities, and we have to share also solutions. So there are moments that are critical, and I think those 3 moments for me were very critical.
I want to ask you about Dr. Holmes. You mentioned him and he was a mentor to you. He was a noted HIV/AIDS researcher. Can you talk about how his mentorship became so valuable to you? And you were involved with HIV research during the early period of the outbreak.
Yeah, well, it happens that around the time that I graduated, the HIV pandemic was starting. So like right now, everything is COVID. At that point, most of what we were seeing in the hospitals, in the wards was COVID. So in a way, most of us, the young people that were entering, young physicians that were entering to start working had to deal with HIV and COVID. So I did internal medicine first, and but I was sure that I wanted to do infectious diseases. So I applied to several universities. I was accepted. I was not accepted initially to the University of Washington, but then I received a phone call from King Holmes, and he interviewed me through the phone. And I thought he was a very interesting person. And eventually I decided to go to do my residency there. He was working on STDs, and I was completely shocked because I never learned anything about sexually transmitted diseases. By the way, just saying sexually transmitted diseases will make me blush, okay, at that point. But they were very much related to HIV. So the way he connected with people and connected with his mentees was incredible, because he was very close. He was kind of like a friend, but also a guide. I never really realized the type of mentoring that he had until I started to work with my own students, right? He was the person that will give the opportunity, for example, or look for an opportunity to introduce you to people that was important, was to people that he thought could be important for you to meet. So to understand other things and to create a network, because networks are quite important. We discuss a lot about issues. He was always open to new ideas. And the most important thing I think about his mentorship is that after talking with him, and after he has given you lots of things to do, you felt really happy because there were so many good ideas that you could try, although later on you could realize that that meant that you had to work a lot more, but it make a lot of sense, you know.
You returned to Peru after the University of Washington in 1997 and began a career at the Ministry of Health, working on STDs and HIV/AIDS initially. And then you became the chief of Peru's National Health Service from 2006 to 2008, the first woman to hold that position. And then Minister of Health for the nation of Peru in 2016. Take us through that period of, I'm curious, first of all, you know, being a woman must have been particularly tough when you began, you know, to assume significant positions within the National Health Institutes in Peru. What was it like as a woman? And what was it like confronting the range of politics versus public health decisions that one has to think of?
Yeah. So first of all, I have to tell you that I never ever planned, okay, to work in the government. And I think my only, and maybe this is a message that needs to be given, and because I think it's important. I don't think we should have a plan of what type of position you would like to be at, but what is the goal that you have for your life? What would you like to change, or what would you like to achieve? And actually, that was one thing that I have clear, okay? I wanted to try to improve public health in my country. And that is why, although I trained in the US, which was kind of like an accident because I never planned before in my life to go to the US, I did it because my plan was to bring my father, who had lung cancer, to be treated in the US. At the same time, I was doing the residency there, but he died before, so I had to complete my plan. So that's why I decided to come to Peru and work here. The opportunities arise, okay? at the point where I was coming to Peru, I was very well trained on HIV and STDs at a very high level center like the University of Washington. And so I thought it was going to be great to create the basis to have a good STD HIV program. And actually we work on there. I don't think at that level I saw any problem being a woman, okay? And I never thought about the issue of being a woman. And although in my medical, when I was studying medicine, we were 57 people and we were only 6 women, okay? But still, I mean, our relation was like very fluent. I have to tell you, I had no problems there. But as I was going up on positions, I think one of the moments in which I have seen more clear the issues of being a woman in power had been when I became Minister of Health. Although when I was head of the National Institute of Health, I had this situation also in which, because I stopped something that was going to be a huge purchase of supplies that were not needed for a big amount of money, and it ended up that it was a problem there. Okay, I'm going to stop there. I'm going to say a problem, but I stopped it, so it never happened. I ended up being accused of having a lover. Okay, and I was buying computers from a lover, and there was no purchase of computers. There was no lover, of course, but as a woman. So if I was a man, probably they would have tried to find another way of attacking me. But in this case, because I was a woman, that was the worst way to make me feel bad, right? So that was a very tough moment. I have to talk with my family, my kids, etc. And then everything was clear. But as they said, and I learned in the government this, they said like, you just throw garbage and the smell stays. So that's what they were trying to do. But when I was minister, I was several times through the College of Physicians, through some colleagues, people from the Congress, they were always trying to demean my actions, okay, because I was a woman, okay, and it is tough and it is hard, okay, and I think as you go higher, those kind of attacks and situations are going to happen, and all the things that you read, and this is for some of the women and professionals that are listening to me, like they said that if you say something as a woman, they will say that you are a crazy woman. That if you were a man for the same thing and the same words, they will say that you are very bold. Okay, so those things happen. So I think we have to be prepared, and I wish I could have been prepared before I was taking these positions. But what I did on my behalf, what I did is I read a lot of books. And I discuss with other people, and I discuss even with mentors in certain situations which I needed a little bit of support. So it's real, it happens, but I think people had to be prepared. It was tough in some situations.
When the president offered you the job as Minister of Health, you thought it was a joke, and I think you almost hung up the phone on him. Can you talk about what happened?
Yeah, well, it was incredible. So this was, it was a Sunday, and I was with my family in the garden, and then the phone rang, and I heard a voice that sounded familiar, and actually was this the new president, Pedro Pablo Kuczynski. Well, actually the voice sounded like him, right? But I thought it was a joke because the previous week, several of my colleagues were discussing from the School of Public Health, were discussing, oh, do you know who is going to be the Minister of Health? Oh, would you like to be the Minister of Health? And everybody was like laughing and joking about that. Nobody knew who was going to be the Minister of Health for this new president, okay? Because he had a very interesting group of people working with them, but nobody that had to do with health issues. So when I received that phone call, I was very careful because I thought that one of my colleagues, most of them are men, were joking with me, okay? And he said like, hello, is this Dr. Garcia? And the only thing that I said like, yeah. Yeah. Well, this is Pedro Pablo Kuczynski, who was the president. And I was like, yeah, I would like to talk to you. Okay. That was the only thing that I was saying, right? It's like, well, I'm looking for a minister of health. Uh-huh. So it sounded like a joke. So finally, he told me that he had my CV, that somebody gave it to him, and that he was looking for somebody who knew about public health, and that he wanted to interview me to go to his house. I was like, oh my God, right? And where do you live? And he said, like, well, he gave me his address. And he told me, but you will find a house because 10 blocks, from 10 blocks there will be some police following your car or coming with you. And I was like, oh. So it was true. I end up going in the car with my husband, my dogs, and my kids. Okay, all together. My kids were excited about this. I was still not believing it, but it was a great interview with him. We talked for a couple, 2-3 hours. And actually, I asked him why he was interested in public health, right? And he told me that his father was a Jew doctor in Germany at the time of the Second World War. And trying to save his family, he flew all the way as far as he could to farther Peru. And he ended up working in the jungle of Peru with people with leprosy. And his father asked him only for 2 things before he died. One, never go into politics, and he failed him. And the second, find somebody who can do something good for public health in Peru. And that's why he was looking for me. So you can imagine that after somebody tells you that, you say like, oh my God, right? I knew that it was a political, that the country was having a very unstable political situation because he won the election just for a very few number of votes. So there was going to be, and the Congress was from the other party. But I thought it was an opportunity. And although I stayed for a year and 4 months, I have almost tripled the average time of ministers of health. And there are several things that I was able to, with the work, with hard work and with a very good team, we have been able to establish, and still is lasting.
What were those things that you were able to establish, and what are you most proud of during that period?
Well, there are several things that I mean, I had a list, but I don't want to go over the list. But one of the things, for example, is like we really push HPV vaccination, okay, which is a very important thing. And we decreased the number of doses from 3 to 2. So to make it much easier, and we even create a competition between the 24 regions in Peru. And the competition was just for a certificate, which was the region that could reach the higher rate of vaccination. And actually, we have regions that reach almost 100% vaccination at that point, okay? We work also with the Ministry of Education. Never before these type of actions were really organized with the Ministry of Education. By the way, all the other members of the ministries at the time of the cabinet, at the time I was minister, were really incredible technical people. So it was really good to work all together. We also reintroduce the after day pill. So the pill that you can take, the contraceptive after, for some reason, people have sex as a way of preventing pregnancies that are unwanted.
The morning after pill.
The morning after pill, sorry. So English is not my first language. The morning after pill, okay? And that was a big deal here in Peru because it was another way of showing you inequity. If you have the money, you could buy it. It was expensive. But if somebody had an accident or was raped, etc., they couldn't access it because the public sector, which covers about 92% of the population, couldn't use it. So we were able to introduce it, and I think that was a really good alternative. We also introduced electronic medical records in the country, which had been going slow after I started, but I think they are still there, so we are pushing. We introduced an electronic vaccination card, which has been used also for the vaccination for COVID. We introduced another thing. So because I was working a lot on innovation and new technologies for public health, we introduced dual rapid and syphilis tests for in the country, especially for screening of pregnant women and vulnerable populations to make things fast. So it's one stick, two tests, and you can have a result and you can take an action. And other things that we introduced that helped during the pandemic were the electronic death certificate, which sounds like very dark, but actually is quite important, because if you don't have good data, you will never make good decisions, right? So during the pandemic, we introduced this in 2017, but then it took time to train people and start working. So in 2020 early, we proposed to use it in order to be able to know what was going on with the deaths with COVID. And we even created an incentive. So if families or people reported somebody was dying and it was reported in the electronic medical record by a professional that was trained, they will receive a bonus that will help with the funeral for the person. So I think probably that allowed us to count much better what was going on in Peru. Maybe we were one of the countries that was more honest on the number of people that had died. Okay, that has been good, but it has been bad also because it made us look a little worse than the rest, but also allows us to understand what was going on, where we were having the focus of the problem, and in the middle of all this instability, trying to do something. So those are some examples of things that I did and that we also used during the pandemic.
Let me jump into a controversial paper that you wrote in 2017 for The Lancet, entitled Corruption in Public Health, the Open Secret. And it's interesting that it was framed as the open secret. It was a straightforward indictment. And you said that corruption is the biggest threat for the future of global health. And that was in 2017. So what were the repercussions from that article? Has anything changed? And why did it sting so harshly, the fallout from it? Why do you think it just hit people so tough?
Yeah, well, first of all, corruption is something, for me, is the C word that nobody wants to say, okay? WHO, for example, when you talk, they don't talk about corruption, they talk about governance, okay? And governance is a very complicated word, means to be organized, etc. And because we don't have governance, we have corruption, that we don't talk about the problem itself. Actually, I decided to write this article because probably the most challenging thing during the time I was minister was not even being a woman, okay? Because I kind of learned how to handle that situation, okay? But corruption was something that really struck me, because I knew what was going on in the government from the time I was at the National STD HIV program, from the time that I was at the National Institute of Health, and even when I was medical student. So I was born and raised in a country in which corruption exists, okay, unfortunately. But what I saw when I was a minister really struck me, because there was more resources, and with more resources, there was more corruption, okay? So while I was a minister, I started to investigate, because I was like, what can I do? I'm a researcher, and is there something, because corruption has been taken, for me, as a disease of health systems. And if it is a disease, we need to find ways of treating or preventing, okay? And we have to study those and see which ones work. So I was wondering if somebody had done that. And I was shocked to see that there is very little research, a lot that is not, it's very little also if you compare with other things that are discussed, very little that is said, very little that has been studied, because everybody's afraid exactly to what you are saying. What are the repercussions that could come when you start confronting or talking about corruption? So my idea was to put into this paper what I learned, my experience as a minister, what I learned from this looking at what is there, this looking at what is available, and then to promote a call for colleagues to start maybe working together towards trying to find a treatment or a vaccine against corruption, okay? So I receive, and this is, I mean, I was not expecting that. I was a little scared about writing this, but I said like, writing this helped me also, as it was therapeutic, because it was a big frustration. I did several things that I read while I was in the Ministry of Health, but still, I mean, this is a huge thing. And I learned that it's not only in my country, that is everywhere. We are erupting with corruption in global health, and that's a reality, and we cannot ignore it. And we are spending, we are losing as much money as the money that we will need to do universal health coverage. Can you imagine that? So we're trying to create models of universal health coverage, but we don't have the money. But if we work on corruption, maybe we will have the money to do that. So I receive lots and lots of emails and messages from people that were feeling really that they have had the same experiences, but they were frustrated and they wanted to do something. So at some point after the publication of this article, the idea was to try to convene a group of researchers, maybe as a commission, as a Lancet commission, to start discussing what to do and what was next. But then the pandemic came, okay? So that has delayed a little thing, some of the things, but there have been some answers that have come out that I think are quite interesting. So there are some groups in the UN that are quite interesting. For the very first time, they are thinking about corruption in global health, because they have thought about corruption in commerce, corruption in banks, etc. And we have been discussing about what are the similarities, what are the instruments that are used to avoid it? I mean, what can we use, etc. A group of researchers were sitting and we're discussing what are the kind of things that we can do, and hopefully we will have a commission and we will start working on this. And the other thing is, at least on my side, I mean, even at my university, we're teaching a course or we're teaching classes and we're discussing about corruption and how to address these kind of issues, because it's difficult. Even when you want to do research associated with corruption, you have some barriers, which are the ethics committees, because there are things that we don't know very well how to handle. However, probably it's more unethical not to start doing something if we know that this is a big problem.
Let me ask you one final question.
Yes.
And then we're going to take questions from the audience. You know, you've talked a wide range of the success and achievements that you've had. And as you moved up in rank and the difficulties of being a woman and confrontations and the difficulties, and, what would you tell? I know that when you were at Stanford, a year plus ago, I guess it was more than that, actually, one of the things you said at a conference to women, raise your voice when you need it. And I wondered, what advice do you wish that you would have received when you were making your big leaps in your careers? And what would you like to tell women about some lessons for them as they ascend in careers in public health and medicine?
Okay, so, I mean, definitely this issue of raise your voice when you need it, get a chair into the table, even, so try to make the space and say what you are thinking. It's quite important. But there's another thing that I have learned, okay, which is critical. So if you are ascending, try to pull up other women with you too. So one of the problems that I have seen is that several times your worst enemies could be also women, because it seems like we are used to have a very small space and we are fighting for it. It's like men are more used to work as football teams, let's say, okay? So everybody get played together. But women, we're trying to create our own space, and that's really terrible. I think if I have the opportunity of going up, I should try to help other women to do the same. That's what I'm trying to do with my students and with the people. But then one of the problems that I have seen is that several times women try to avoid conflict, or are trying to avoid being in situations in which they can be in problems, right, or risks. So I think it is important to take the risk and to take the opportunities. So that is something that also I have learned. And finally, and this is finally because you asked me what I would have liked to hear from somebody, okay? I think we need to build resilience, okay? And that had cost me a lot because there had been, I mean, we have been talking about good things, but in between good things, there had been bad moments too. This moment about being told that I was having a lover was one of the worst ones in my life, to tell you the truth, okay? Because I was, how come, okay? It was a big lie. But it was, how can you tell everybody, if that comes in a newspaper, how can you assure that everybody that read it in the newspaper will know that it's not true, right? So it's a very hard thing, and you take it very personal, etc. I think we need to learn from those experiences to become more resilient. And bad experiences are only worth it if we learn from them, okay? So those two last are the ones that I have learned recently. I have been attacked, I mean, the same way that I have been applauded by this corruption article, I'm being also attacked by others, okay? And that has been hard. And I'm sure that it's going to continue to be hard, but I'm building myself in order to be more resilient, because I know that when you are getting near, the dogs start barking. Have you heard that from the El Quixote? And it's true. Okay, so nothing is personal, be resilient and help others. Those are critical things, and raise your voice when you need it.
Thank you. We're going to take some questions now from the audience. The first one was the peak in COVID infections last year associated with the type of vaccines being used? For example, were you using American or lower impact vaccines from China and Russia? So was there lower efficacy because these vaccines were, from other nations, produced in other nations like China and Russia, not the US?
Okay, so thank you for that question. The reason why we have a second peak is because we didn't have vaccines at that point, okay? So basically, although Peru even had the money, because we had gone through a very productive period and with good economy, that we had some money left aside for emergencies. So we had the money to buy vaccines, but we were not able to get them. There was no negotiations that could really allow us to have vaccines on time. And we started to have vaccines later last year. Okay, so it was probably, we started vaccinating in February or March, okay? And by littles. It is true that the vaccines that we had in Peru initially were Sinopharm, just the Chinese. We never got the Russian one, okay? And eventually, and we were part of COVAX also. And although we were having the money, the amount of vaccines that were coming were very small. So we had to start by vaccinating health providers, people with high risk. And it was difficult also to reach some of the people that are high risk in rural areas. There were several things that had to be prepared. So I do think that the problem was not the quality of the vaccines, but the quantity. As soon as we have been able to access vaccination, I mean, I'm telling you now, I mean, with such a high rate, and that's because we have a very good acceptability of vaccines in general. Now, cases are down and things are not bad as they were.
Great, thank you. Here's a question from Mona Hussein. Keeping in mind that compliance to any global program is key for effective outcomes and LMICs, as Minister of Peru, what strategies were the best for behavior change and compliance to global health programs? So how do you change behavior?
How do you change behavior? That's a very difficult question, actually. So let me see. let's think about one strategy. I think there are several things that need to be worked. For example, vaccination for HPV, okay? There are things that need to be done at the level of the individual, but also at the level of the community. So first of all, for the HPV vaccination, one of the things that we analyzed was that there had never been a real campaign, a real clear campaign to understand what were the advantages, the disadvantages, and what was offered, okay? So good information is one very important step. The second thing is, how can you facilitate the process, okay? It's not only changing behavior, but making things easier. I will go to the other. So one of the issues for girls to receive the vaccine had to do with parents writing a consent form that was supposed to be given to the teacher at schools, because all the vaccinations were given in schools. And the schools didn't know about HPV. The teachers were against HPV because nobody had HPV vaccination, because nobody had talked to them about that. And nobody knew where to find the consent. So what we did is, again, improved information, answer questions, and then and create easier ways for parents to be able to find the consent and getting answers when they were having questions regarding the vaccination, okay? And in a way, that helped changing the coverage immediately, working together with the schools and with the Ministry of Education, because we gave more information, okay? So changing behavior at the individual level had to do also with understanding at what level of change the people is, and also trying to facilitate the change, giving them the information that is needed, and making them realize there are lots of techniques that can be used individually, right? Make them realize if there are situations that are similar that they went through before, that they could use, maybe those strategies could be used also to change the behavior. But one thing is at the individual level, and another one is at the level of a strategy. And that's what I was trying to give you, the example of the strategy of implementing and improving the coverage of vaccination for HPV. Of course, monitoring, including information systems, for example, these vaccination cards, trying to see what was going on in real time, creating incentives are other things that could be used.
Thank you. Here's a question that a few people have asked. What recommendations do you have for a young professional who may be interested in building a career in public health?
So first of all, I congratulate you, because I think that people that work in public health and global health eventually will have a space in heaven, okay? So what will be my recommendation? So do not think, and I said this before, okay? Do not think about the position that you would like to get. Try to think about what is the goal that you have for your life. Since I was little, I remember that I always wanted to improve things, okay? So in my life, that gives me a lot of work, okay? But that gives me also the satisfaction of seeing things better. So be clear of what is the goal of your life, okay? What would you like? And I'm sure that if you are trying to work with public health, is because we want equity, you want the world to be better, etc. The third thing is seize the moment and don't be afraid of taking certain risks, okay? And take opportunities. And my last recommendation is always take the time to learn from the experiences, the good ones and the bad ones that you have. Oh, I said my last one. No, my last one is, it might be good to identify somebody that you trust or you think that has a career that you really appreciate, and try to get a mentor or a friend with whom you can discuss certain things. I think especially for women, one thing that I have always thought about, and actually we're doing this in in a way with some of the people that I work with. Sometimes you need some group support for certain things, especially for women, because we are trying to be super women in everything in our life. I mean, we want to be perfect, going to the gym, cooking perfectly, doing gardening, taking care of the kids, and having a great career. And sometimes that's not possible. So be realistic, and having other people that are going through the kind of things that you are doing and learning from their experiences is also a good thing to do.
Patty, thank you so much. I'm now going to turn it over to Dr. Berry.
Patty, you have been such a strong voice for women and anti-corruption. I really want to thank you and a really good friend for many years. I want to thank you for that. I do want to ask you one question, because corruption is such an issue, not only in Peru, but we see it in our own government. I was just looking at the front page today on how McKinsey is consulting for the FDA, as well as Purdue on the opioid crisis when that was happening. What parameters can we start looking at in order to do evidence-based change in corruption?
See, Michelle, that's a very difficult question, because what we are trying to discuss, and it's true, that's another limitation to study and to improve corruption, okay? The fact that we don't have very clear what are the indicators that we can use, okay? So I think there's some, well, how can I tell this? So there are different ways of evaluating the impact of corruption, okay? How much money we are losing, for example, okay? But in order to do that, most of the studies that I have seen regarding how much money we are using are studies that are being done retrospectively. So at this point, we're starting to discuss, I mean, what indicators we can use. Some of them are the voices of the people, getting, in the case of global health, remember that there are like 6 different things, like absenteeism, for example. It's very easy to measure absenteeism, okay? But the problem is that we have not been doing much. We know that people that is supposed to go and work in that rural area, maybe they are not going to their shift because nobody is monitoring anything. So what we need to do probably is more to have better systems that will allow us to have better traceability of what is going on and more monitoring and finding out why that is happening, right? So depending on the type of corruption or corrupt situation, we may need different indicators, but I think there is no standard, and this is the moment in which we should start discussing which ones are we going to use and see how they work.
Thank you. And thank you for being this strong voice for equity and also for women and males as well. I've listened to you really stand up for Latin America, which is often not included in lots of the global health agendas.
Absolutely.
Yeah.
Thank you so much, Michelle. Thank you for the opportunity. And somebody was asking me if I would like to be a mentor. I mean, I mentored people here in Peru. It will be good. I mean, cultural issues are also important, but if you want to write me an email, you have questions, and there is something that I can help you, it will be my pleasure.
Thank you too. Bye-bye.
Bye-bye.